Okay, so now that we've looked at some kind of bony structures and some passive, we're going to look at a few contractile muscles and structures around the hip. So we've talked about the anterior side, the ASIS, kind of that iliac crest. First, just to kind of orient ourselves, we're going to find the PSIS. And sometimes this will kind of sit right where the waistband is. And so depending on, the clothing of your patient, pulling the shorts either up a little bit or down enough to be able to kind of access that iliac crest, come around posteriorly, and then you should find the PSIS relatively easy, particularly on some leaner patients. From there, we know that we want to come just a little bit anterior from there, and then just inferior is going to be start the more superior fibers of our glute max. There's 3 different fibers from there of the superior fibers. If we get down into really the meat of the glute, that's going to be more of our middle fibers, which is probably the largest portion of our glute max. And then your inferior fibers tend to run towards the bottom, but if you actually kind of trace the glute out towards the lateral insertion, you should be able to kind of feel just at the bottom of the glute and where you feel kind of that gluteal tuberosity of the posterior side of the femur. But really just to kind of make sure we have a good outline of the glute. What I want you to do, Karen, is just keeping your legs straight, squeeze your glute, squeeze your butt cheek here, raise that heel towards the ceiling. Good, and you can kind of see the outline here. And so if we were to work our way towards that bottom corner, you can really kind of feel that glute tendon of the glute max there and where it inserts. Go ahead and relax. So that's really our glute max. From there, we're going to orient back to the PSIS in order to help find the piriformis, which is a really important or primary external rotator of the hip. So again, we find the PSIS right here on both sides. Now, the piriformis lies fairly deep relative to the glute max, and it really kind of sits and lies more laterally. And so if you were to find the greater trochanter right here on the lateral aspect of the femur and just kind of draw a ridge between the PSIS and that greater trochanter, right in the middle portion of that ridge, right in and around there should be the piriformis. Again, it lies pretty deep, so some individuals, you might be able to feel those fibers by moving inferior and superiorly up and over that tissue or that muscle. But it lies pretty deep, so if you get in there with the elbow, you can kind of start to feel that fiber, and you can always ask your patient. But again, it's an external rotator, so if we pull them into external rotation, get them to contract. So I want you to pull into my hand here. Don't let me pull you out. Good. And then I really feel that kind of ball kind of jump out at me a little bit. Go ahead and relax. And you can kind of just, confirm that you're on those fibers and just work your way inferiorly and superiorly over that. Were you able to feel that kind of tenderness there, Karen?
Yeah, for sure.
Great. So go ahead and lay on your right side for me. We'll get our left hip kind of towards the ceiling. Good, awesome. And so the last one we're going to look at is the glute med. And so the glute med, again, we'll kind of orient back to the ASIS, and it's going to be a primary hip abductor. And so what we're going to do is find the PSIS. Let me just double check here. Yep, and we're going to work just slightly anterior and slightly inferior from there. And good. And you should be able to, again, feel that. If you were to kind of raise your leg towards the ceiling, good, you feel that bulge out and kind of jump right out at you. It's a little bit of a fatter of a muscle. Go ahead and do one more time for me. Good, and that fiber right there is going to be our glute medius.